And then I would like to introduce to you Mr. Ignacio Sanchez Diaz, and you work as in a UN project, sustainable procurement in the health sector, hosted by UNDP. You're most welcome.
Yeah, thank you very much. All right, so first of all, thanks a lot for the invitation. It's great to be here and also to see the commitment that Sweden has on this topic. So it's great to see these initiatives at the national level. So today I will talk about the sustainable procurement in the health sector. This is an initiative from the UN system. Officially, it's called UN Informal Interagency Task Team on Sustainable Procurement in the Health Sector. So, in order to sort a little bit the name of the group, we call it SPHS. This initiative it was created in 2012, and nowadays it has 7 UN agencies and 3 multilateral health financing institutions. The whole aim of the initiative is to improve the environmental impact of the health procurement, and at the end improving the human health and well-being. We try to do that in a transparent and inclusive way, and also using the purchase power that we have, that is around $5 billion US dollars per year just for the health programs among all the members. And also we another strength from the group is that we have a kind of a regulatory group, a regulatory authority role with the whole World Health Organization and the United Nations Population Fund, that they are setting quality and quality criteria for the pharmaceuticals. So it put us in a situation where we believe that we can influence some of the portions of the health manufacturers and suppliers. Just to finalize with the presentation of the initiative, we are right now, UNDP is hosting the secretariat of this initiative, and we have around 3,500 institutions and experts in our network list. So we believe that it is kind of also a good initiative to engage with different technical experts, with suppliers, with stakeholders from different countries. The objectives of the initiatives are the establishment and promotion of standards on what is sustainable procurement. Then, as I said, we want to use the purchase power of SPHS as a strategic tool. We believe that through including green procurement and sustainable procurement criteria in our procurement programs, we can really influence the suppliers and we can improve the supply chain. As I said, we engage with different UN procurement officers, we engage with suppliers and manufacturers, and we are also trying to engage with different key stakeholders. And finally, and I will talk a little bit more at the end of the presentation, we are also trying to facilitate this knowledge and practice sharing between all the technical experts that are in our network and our suppliers and manufacturers. So we call this kind of B2B, business to business stakeholder engagement, and we, from this engagement with suppliers, what we heard also is like, okay, guys, we are ready. We want to really improve our production, but what we are also expecting is some support from your side. So here is where we feel that we can facilitate this better practices, helping them through our technical experts. It was mentioned during the morning about the new Sustainable Development Goals. UNDP is one of the lead agencies on the implementation of the SDGs, and we believe that the SPHS is a practical example on how these goals, they can be implemented in the developing regions and through the development programs that we are leading. And to do that, we have come with 9 focus areas. Here we presenting them. It's just in order for the initiative and for the members to really categorize the different projects and activities that we are doing in different focus areas, so we can really advance in these specific areas. Now I will talk a little bit more in detail about what UNDP as member of this initiative is doing on sustainable procurement. First of all, it was developed a new UNDP procurement strategy for the period of 2015-2017. This is the first time that a UN agency introduced in the procurement strategy some of these concepts as cleaner supply chains, purchasing innovation, better integration with programs and partnerships, transparency, as Pauline was mentioning, and also there's this specific or more than specific. There are broad key purchasing criteria on sustainability, social cost of carbon emission, South-South cooperation, and women's empowerment. But this is a strategy, so at the end, this is paper and it has to be translated to some action. And this is where we've been developing some projects. The first one that I want to talk about is the development of a Green Procurement Index Health. The final aim of this project, of course, is the development of an index that will be able to monitor the progress on introducing sustainable procurement criteria in the health sector. That is kind of a long-term goal, but in the meantime, I just present here the roadmap of the Green Procurement Index. We are right now in the phase 1, where we are trying to develop like the different components of what it will be the index. And one of the components that we have realized that we can implement quickly and where we feel like our procurement teams and also in the countries they can really progress quickly is about the international conventions. We have identified 5 international conventions on chemicals. Why we focus on the conventions? Because we feel like this is a tool, if we can call it that way, of really engaging with the country level. Many countries are signatories of these conventions, so it gives us kind of a entry point also to the implementation of sustainable procurement in the countries. So we have identified that for health programs, the Stockholm Convention on Persistent Organic Pollutants, the Minamata Convention on Mercury, the Vienna Convention and the Montreal Protocol for the protection of the ozone layer, Basel Convention and Rotterdam Convention are the key ones. So basically what we have developed is this UNDP pilot guide for procurement practitioners, where we have established checklists and some indicators that are going to be provided to our procurement people, so they can already start monitoring how much of the procurement of our products and from our programs is compliance with these conventions. The publication is right now just finalizing the layout of the publication, so it will be ready, we expect, in the next 2 or 3 weeks. But I wanted to take the opportunity to present it already here. Just as part of this pilot guide, we already conduct an initial assessment of the UNDP on the UNDP compliance on these conventions, and I mean this is just an sample of the dashboard that we are presenting for our practitioners, our procurement practitioners, so they can really, in an easy way, monitor the compliance. A second component of this index is going to be about what they were mentioning, that one of the lack things is on the information that is available. So what we are doing also is developing a environmental questionnaire for our suppliers and manufacturers. It's also being finalized and getting into an official agreement inside of UNDP, so it will be presented as a corporate questionnaire for UNDP. It was based in different international standards, also in many other questionnaires and scorecards from other national and international organizations. Basically, we are not trying to reinvent the wheel. I think at this point we know more or less which are the areas or the aspects that we need to collect information. So what we also used, it was the consultation and international consultation to obtain the feedback from different technical experts. Some of them today are here with us. So we really thank the input that they provide to the questionnaire. And how we are going to implement this or how we are going to integrate this in the GPIH, the Green Procurement Index, is going to be through the development of supplier profiles. This is going to be a second phase that we are initiating right now, where we want to make, where we are developing a more or less automatic tool that it will translate all these aspects from the questionnaire that are shown here, that are divided in two at production level and the product level. So the tool, what it will do is translate that to a more easy and manageable profile. So our procurement practitioners, they have a easy and ready tool. So they when they need to do the comparison during the tender process, they can use this information. Then the other project that we are developing right now is in collaboration with Healthcare Without Harm. That is an NGO that groups thousands of hospitals around the world. And basically we are developing, the project is about developing some guidance and targets for substitute hazardous products from the UN health programs. Here we just saw a list of key products. This is some of the products that, based on our initial environmental assessment and on our assessment of the volumes that we are procuring right now, we thought that these were going to be the key products where we are going to focus. Basically what we are doing, first of all, is doing a systematic review of the different substitution lists and trying to identify what would be the substitutes and what will be the key components that they need to be targeted. Just quickly on, the objectives and the outcomes of the project. Basically, we will develop some green procurement criteria. We will develop some recommendations for the procurement teams, and we will develop what we call it a red list of toxic chemicals based on the initial list of products that we have identified. And then also very important here is the whole engagement that we are conducting through these projects and through the whole initiative with the suppliers and manufacturers, where we are really trying to hear from them also which are their expectations. And here is where we are trying to come and trying to be a little bit innovative, at least in the UN system, where normally, traditionally, it was always kind of one direction, just giving information to the suppliers. So we are also trying to hear from them, and what we are trying now is we understood that we have a huge network of technical experts and key partners that we've been already collaborating with them. For instance, already we've been with Shiwi. It was one of the first one that we already collaborate with the male condom manufacturers, and we develop some capacity building sessions with them. So these kind of examples that have been proven very successful in the past, we want to do it in a kind of a more standard way, where we are going to identify different technical experts in the different focus areas, and we will provide with all this expertise to our suppliers, trying to advance in water issues, in energy issues, and package issues. Right now, these are the three focus areas where we want to start: energy, water, and packaging. But then we will expand all these to the 9 focus areas where we are. And the last thing that I wanted to present is we have launched the new SPHS platform that is called Saving Lives Sustainably.org. The idea of the platform is to be used as a knowledge sharing platform. I will show you quickly what we want to achieve with this platform. We want to highlight the different successful cases, the different projects, events that are being developed and are happening related to sustainable procurement in the health sector, and basically we want to bring them all together here, and this it will be kind of a consultation platform for suppliers and manufacturers, for different stakeholders, and for the public in general, and trying to learn a little bit more of the different initiatives. It's a very intuitive platform that we have. Sorry. Can I show the internet page here instead of this? So if you just help me 1 second, I can show you how it looks. Can I enter in the internet here? So instead of showing this, I want to show this one. No. I mean, it's open in the internet, but I just want to show this. Okay, here. Sorry. Oh. Just otherwise I will finish and I will just show you. Yeah, it is actually. Don't worry. Anyway, the whole platform, I will just invite you to check later after the conference. Is this Saving Lives Sustainably.org? Basically, the platform we are inviting the different organizations, suppliers and manufacturers from the academia sector. Whoever wants to be interested, you can register on the platform. You can consult the different events, projects that are going on, and of course, what we are inviting is for new contributions to the platform. So we will really invite you, and we are willing to see that how the number of publications and projects is increasing in there. So thank you very much. With this, just end. Yeah, thank you very much.
Can you hear me now? Yes. Thank you very much, Ignacio. Sorry that this last part of the presentation didn't work out. I think now you could actually just click on the link there. Since your project started and we've been in contact for quite some time, it's impressive how far you got, and that you're really getting from the desk work, the networking, to some practical products and gaining specific experience. But we heard a lot about the national and EU regulation, and since the EU system is standing outside of this, how do you sense this operating space? Do you have the freedom to go forward and say, okay, we as the UN, we do this now, we go ahead? With just regulative, we're all born into this thinking of, okay, what can we do on municipal level, national level, EU level, and so on. And the UN is a special case for this.
Yeah, I mean, first of all, if you just notice, the whole initiative is called Informal Interagency Task Team. So that give us some space. Being an informal initiative inside of the UN system is actually good because it gives us some space. So for instance, when we talk about the regulatory aspects with World Health Organization, that they regulate all about the access to medicines and the pre-qualification of medicines. This gives us already the space to already start engaging with the suppliers. So that's one thing. I mean, this is not a competition, and it's not a way. I mean, a goal that we can achieve on our own. Of course, we are really trying to engage with different stakeholders, with the EU, at the national level. But what we experience is, like, at least for the health programs that we are right now leading, we can start changing some things, and that's the introduction of some green criteria that is already happening for some of our medical products. We have started already with the antiretrovirals, introducing some short-term and long-term goals that have been agreed already with the suppliers. So they have agreed to work on those areas, and we will keep monitoring the compliance. So, yeah.
Great, thank you. Any further questions to Ignacio and the SPHS program? Doesn't seem to be the case, but keep in mind, although this day is rather frontal in the whole setup, tomorrow will be the interactive day, but some of the speakers are only here today, so take a chance and grab them in the coffee break or whenever. Thank you very much, Ignacio.
Yeah.